Almost exactly 2 years ago, on June 24th, 2022, everything we knew about reproductive rights in America for the last half century changed when the U.S. Supreme Court overturned Roe v. Wade.
Tonight, two Memphis organizations, one pro-choice, the other pro-life, break down what is happening with the Mid-South's abortion laws in this post-Roe world and what's to come.
We just ask that you...
Susan Lovato with Memphis Coalition for Life took the Supreme Court's decision to let individual states regulate abortion laws as a win. What was that day like?
Joy. Joy. I mean, that's why this office exists. This office exists so that babies will live.
But it was a huge loss for Jennifer Pepper, the CEO of Choices Center for Reproductive Health.
And that breaks my heart.
That provided abortions in Memphis since 1974.
We couldn't stomach the idea that we wouldn't be able to help the people that had relied on us for over 5 decades to take care of them.
Abortions are banned in Tennessee, Mississippi, and Arkansas, with an exception if the mother's life is in jeopardy. Mississippi is the only one out of the 3 that allows an abortion if the pregnancy resulted from rape.
So anything that happens to the mother, incest, abuse, it doesn't change the sacredness of that life.
Quite frankly, a lot of healthcare providers are scared. They don't want to lose their license. They don't want to end up in jail, but they want to take care of their patients. And so it is a really terrible position to put healthcare providers in. And it's the position the state of Tennessee has put them in other states across the country.
Since the Dobbs decision, the Society for Family Planning's We Count study shows an increase in abortions nationally from an average of 82,000 per month in 2022 to 86,000 per month in 2023. The data shows abortions declined in many of the red states like Tennessee, which either have a total ban or a 6-week ban. The yellow states have restricted access to abortions. Now, the green states, which have the most open, accessible abortion laws, well, those saw the most significant increases, with Illinois being the closest one to the Mid-South.
We opened a second clinic in southern Illinois, which is a 3-hour drive from Memphis, also a 3-hour drive from Nashville. Last year, we saw over 3,500 patients there from 21 different states. 95% of those patients were from outside Illinois, and primarily Tennessee, Mississippi, and Arkansas.
We had advocates stand on the sidewalk at Choices and Planned Parenthood, offering resources to women who are in crisis. I would say 40 to 60% of the women that we greet are in crisis, like they are in a living situation which is unstable.
The study says telehealth contributes to the increase. Patients in restricted states can get prescribed abortion pills virtually from states that have shield laws legally protecting providers from criminal or civil actions. Governor Bill Lee made virtual abortions a felony for providers in Tennessee.
What telehealth does, it takes a woman away from a doctor who could recognize a need and a safety issue. The most dangerous parts of pregnancy, which would be ectopic and tubal, which is what is always brought up as the most dangerous thing. But a chemical abortion through the abortion pill does not rectify that danger.
Can a telehealth provider in a state with shield laws see a patient in Tennessee?
If she could find one, absolutely. But she's not going to be able, nobody in Tennessee is going to be able to take care of her. And not all telehealth providers are going to be willing to see a client in Tennessee. There are a few out there, but not all of them.
Governor Lee also signed a law to criminalize adults who help minors get an abortion without parental consent, which goes into effect July 1st.
Parents need to be able to be involved in the health care of their children. This involves their children and grandchildren.
There are instances of abuse, there are instances of neglect, all sorts of things that make the parent potentially not a safe person for that young person to talk to about their pregnancy or their need to access abortion. And so those are the young people that this law hurts.
Where do you see the future of reproductive laws in Tennessee going?
Well, I can tell you what I hope. I mean, I don't think it's outside the possibility of prosecuting anyone. I think that Governor Lee and our legislature are committed to the safety and health of Tennessee residents.
And we are even taking it down.
I think, unfortunately, We have potentially not seen the worst that it's going to get. There are certainly rumblings around IVF, intravitreal fertilization, and as well as contraception. And so this election in 2024 is super important.
We have prayer.
Your state elections are super important.
Their eyes will be open to the true evil of abortion.
Because we are still fighting, and the fight's not over.